Think about the words finance, money, and cost. When you think of these words, what feelings come up for you? We all have different feelings about money. Some of us might feel anxiety, frustration, anger, embarrassment. Others might feel indifferent or confused. Some might feel excited, hopeful, relieved, or happy. We might feel many of these emotions, often simultaneously. What we feel will change depending on the situation. We ask you to think about your feelings to illustrate that finance is very personal. We each have a unique, emotional, and personal relationship to money. Because finances are so emotional, and because our financial situations affect our livelihoods, our security, and our physical and emotional safety, conversations about money can be difficult and triggering. This is true when discussing individual finances, as well as organizational finances. All too often, money problems are seen as personal faults, even when the individuals affected often have no or very little control over the financial situation under discussion. The dynamics that affect our financial situations are often much bigger than we can control. Let's look at how these dynamics might affect your clinic and your patients. On an organizational level, healthcare clinic leaders are held personally responsible for financial situations that are often out of their control. For example, reimbursement rates from insurers do not cover the full costs of delivering the highest quality care, so safety net clinics must look for other sources of revenue to cover the gap. One common source of additional revenue to cover the gap is foundation grants, but competition for grants is high, and general operating support grants can be hard to get. These difficult financial dynamics often leave organizations forced to operate with very tight margins while still providing the highest quality care. This means organizations are using every dollar they are bringing in to meet the needs of today. There are few opportunities to set aside savings for the future or to support continued investments in an organization's people or medical equipment. At an individual level, patients come into your healthcare clinic with their own financial situation and feelings, which can come into play during their visit. In your roles every day, you might be dealing with patients who are experiencing lots of feelings around their finances at that moment. Clinical staff might be talking to a patient about their health, but that patient might not be able to think about anything except their ability to pay for any potential treatment. They might be experiencing any number of feelings that have more to do with their financial situation than their medical situation. They also might not want to share those feelings with a medical provider. Front desk staff might be talking to a patient about the bill, and the patient might be embarrassed about being unable to pay, even if the circumstances are out of their control. Conversations around payment can be triggering and difficult, but they still need to happen. Clinic team members should approach these conversations with that in mind. Patients should be considered active members of their care team and respected when financial considerations are brought into the conversation. This means giving patients the information necessary to make informed decisions about their care, including financial information. It means being sensitive to all the feelings that financial conversations might bring up, and doing the team's best to make those conversations as safe and comfortable as possible for the patient. Our financial situation does not define us, not as individuals and not as organizations, but it does affect us deeply. The better each individual in the care team understands these dynamics, the better care you will all be able to deliver to your patients.